So I call the TGLP combination, testosterone and GLP-1, the closest thing to a fountain of youth that we've ever had.
Welcome back to the TRT and Hormone Optimization YouTube channel. And we have back with us as a guest, Dr. Rudy Eberwein. Welcome back, Rudy.
Hey, Stephen, always a pleasure to be here. Great seeing you.
Nice to have you. So today we're going to start with a talk about TRT and GLP-1. What news about this combination?
So this is, I'm going to tell you my favorite tool when it comes to optimization of my patient's health. As a anti-aging physician and optimization physician, we're always trying to see what tools can we use to optimize metabolic health, because we know that metabolic disease is the main driver of the chronic illness epidemic that we'll see not only in the US, but all over the world. But I think the US is the epicenter of metabolic disease. So there was a recent study that showed that 93% of Americans suffer from some kind of cardiometabolic dysfunction. 93%. If you try to go with metabolic disease, you can bring that to maybe 2/3 of Americans. And let me go over some scary statistics with you, Stephen. About 42% of Americans are obese. 2 out of 3 Americans are either overweight or obese. 1 out of 5 Americans have diabetes or prediabetes or insulin resistance. Cancer rates are soaring, mostly in the younger population, less than 50. Heart disease remains the #1 killer. We have almost 700,000 deaths annually in heart disease. Our population is getting fatter and sicker despite the available information that we tell our patients. You should eat less and exercise, right? So this is what we've always had. I've studied nutrition and food sciences as my undergrad major. I've had my weight loss clinic for the past 20 years. Actually, this year is 20 years. And I've been screaming at the top of my lungs to all my patients, eat better and exercise. All of the experts are saying the same thing. But what's happened over the past 20 to 40 years? We've had an increase, a soaring increase in obesity and obesity related diseases. So clearly, what we're doing is not working. So enter GLP-1 medications. And what's interesting, we've had this talk before, Stephen. Ozempic, semaglutide, was FDA approved in 2018. And that's when it entered, GLP-1s entered consciousness of the world. They thought that only semaglutide in 2018, that's when we had GLP-1s. I've been using GLP-1 medication since 2005, since they were first FDA approved. Because they were first FDA approved for diabetes, they did not have great success on weight loss back then. So the first one was exenatide. So just that's to give people the context on that GLP-1s are not a new treatment, just the Ozempic and Mounjaro starting in 2018 have become more effective. So now let's go back to the metabolic crisis that's affecting our world. Clearly, the status quo is not working. So we needed new tools. And we've talked many times on this podcast how amazing those peptides, because remember, GLP-1 is a peptide, and it's truly revolutionizing healthcare, revolutionizing metabolic disease and treatment, because we've never had anything that is as effective at helping people change their relationship with food, be able to get free of the food addiction that is plaguing 70% of our population. So I've used GLP-1s without any shame and without any issues on my patients who need it because I've seen the results. And the studies are phenomenal on the amount of weight loss, the insulin resistance that improves, on a decreasing of inflammation, all of those issues. So GLP-1 is one of my main tools in my toolbox for optimization of metabolic disease. But there is no questions that when you lose weight by any way, but even more with GLP-1, you can see decrease in lean muscle mass. And Steve, what I like with me and you, we are muscle-centric physicians. We believe in muscles and keeping muscle mass. And we've been doing this for years. And even when I was in med school and in nutrition school, I never understood the importance of muscle mass. And now we know that lean muscle mass, is the most important currency for wellness and longevity. The more muscle mass you have as you grow older, the better you will age. less risk of chronic disease. Because again, lean muscle mass helps decrease insulin resistance. It doesn't just look good when you take off your shirt, it's really important. So, what happens as we age or as we suffer from metabolic disease? I call it the double whammy of inflammaging: increased body fat, increased belly fat, and sarcopenia, decreasing lean muscle mass. This is what happens as we age or as somebody's overweight and doesn't exercise. You see increased belly fat, lower lean muscle mass. And that is a recipe for disaster. So, what is the best regimen to combat this? We said already GLP-1 to help decrease belly fat, visceral adipose tissue, overall weight, but now combining it with testosterone to help increase muscle mass and increase energy and vitality. The combination of testosterone and GLP-1 to me is the closest thing to a fountain of youth that we've ever had because it addresses those two components of inflammaging: increased fat, visceral adipose tissue, and decreased muscle mass, sarcopenia. If you can address those two issues, you will have a better metabolic milieu. So for me, interestingly, I'm in Miami. We eat rice and beans in Miami, and rice and beans is a staple over the world. Why? Because when you eat rice, it has amino acids, but it doesn't have all of them. When you combine rice plus beans, it provides you the 8 essential amino acids. So it's a complete meal. So I see testosterone and GLP-1 as the rice and beans of wellness because those two complete each other. For example, and you see that I have a lot of patients who are on TRT, but they are still overweight. They have muscle mass, but they have a lot of visceral fat, or they are overweight. They can't lose the weight. Adding GLP-1 to TRT is a life-changing therapy because now you can really help decrease the fat, decrease the weight, decrease the visceral adipose tissue while maintaining or increasing lean muscle mass. And the opposite is true. A lot of my patients who've had great success on GLP-1, they look good, but they start having that sarcopenic look where you see the muscles are going away. About 45% of patients who have insulin resistance also have some kind of androgen resistance or androgen insufficiency. So, wouldn't it be amazing that now that we've realized how important lean muscle mass is, that we have testosterone as a prescription to increase your muscle, right? Wouldn't it be amazing as doctors that we can say, I see that you're aging, Stephen. I see that you're losing your muscle. I'm going to prescribe you testosterone because we'll be able to build lean muscle mass. And we know that is the most important thing we can do for your wellness and your longevity. So the big question is always, you're going to prescribe too much testosterone. How safe is testosterone? Well, we recently had the Traverse trial that followed almost 7,000 men over 5 years that showed the safety of testosterone. And then me and you, we've been seeing patients for 20, 30 plus years on testosterone therapy, and it is a win-win. Not only do those patients look better, feel better, but their health is also improving. So I call the TGLIP combination, testosterone and GLP-1, the closest thing to a fountain of youth that we've ever had. And any providers who are interested in really helping patients with metabolic disease should know about that combination. And I'm going to always put a caveat in this. This doesn't replace good diet. This doesn't replace good nutrition, exercise, and sleep optimization. The four pillars of health remain: nutrition, exercise, sleep, and stress management. You cannot get away from this. However, many people who know this just cannot sometimes change their nutrition. We see that. Many patients who come to see me will tell me, Doc, I know exactly what I should eat and what I should not eat. I could write a diet book. I can go on ChatGPT and give me a 14-day diet. I know what I should do. I just cannot do it day after day. I'm stressed. The food tastes too good. So it's micro food addictions because the food that we have nowadays is engineered to make us addicted to it. Did you know that in the United States, 70% of our calories come from ultra processed foods? Those are engineered foods that we cannot resist. Our system was not made to resist that. It's not natural food. So the big criticism I get from my colleagues is they tell me, Rudy, you pay too much attention to the GLP-1. We need to change the food source. We need to make our food healthier. And I agree. I agree 100%. And I'm fighting for this. And now I'm excited to see that in the US, we're talking about this, right? We have the Make America Healthy Again movement with RFK Jr. that's finally bringing to light things I've been talking about for the past 20 years. And we need to change our food system. But let's be realistic. How quickly do we think is that going to change? There's too much money riding on this, too many lobbyists. I'm optimistic, but I don't see things changing quickly. So, for the doctors who say that don't use GLP-1, just tell your patient to eat less, eat organic, and exercise more. I wish all my patients could like this. And for my patients who can, what is it, maybe 20%, 30% of my patients who can do diet, behavior modification, exercise, and maintain their weight, good for you. If you can do it without using any hormones, any supplements, I applaud you. And I want you to keep doing this. However, for the other 70% of patients who are overweight or obese, the other 93% of patients with metabolic disease, we need to realize we need tools now. I cannot wait for the government or big foods to change the food source to become healthy. So I believe in the MAHA, Make America Healthy Again. But my biggest point is MyHA. I want to make you healthy again. Only you have that power. And when I can give you tools like GLP-1 that make you decrease your addiction to those foods, I can give you testosterone that helps you regain vitality, health, energy, wants you to live life again. Now I make you healthy again, and you can make better choices. And the way we change the collective as by changing the individual. So I'm not going to sit down. I consider myself a foot soldier in that war against metabolic disease. We need generals like RFK Jr. and those guys who are going after the Senate and in the government to try to change that. But it's not going to change overnight. We need foot soldiers with effective tools to help us deal with the disease right now.